Hi, my name is Jamie Calloway, and I will be presenting an innovation designed to assist newly licensed nurses not only obtain their ACLS certification, but recognize the need for study preparation and repetitive, deliberate practice following certification to improve their knowledge retention. Literature shows that poor knowledge retention and lack of confidence following ACLS certification leads to poor patient outcomes. Current literature also demonstrates that resuscitation training should include follow-up, simulation, and frequent review. As a new graduate, I recall feeling less than prepared in my ability to perform in a code blue situation. The American Heart Association requires ACLS recertification only every 2 years, but the evidence shows improved performance and outcomes in hospitals that require quarterly simulation and testing, as well as CPR. There is strong evidence to suggest that in-hospital cardiac arrest survival depends on nursing to initiate CPR and deployment of defibrillation prior to the arrival of the physician team lead. According to a study from 2016 published in the British Medical Journal, the infrequency of in-hospital cardiac arrest, coupled with evidence to suggest that ACLS knowledge degrades in as little as 12 weeks, nurses are not prepared to deliver a prompt and coordinated response in the event of an emergency. This innovation topic was initially developed after meeting with my preceptor and a small group of experienced ICU nurses, along with six newly licensed nurses. My preceptor works as both a professor with BSN students as well as new hires during their new employee orientation. The topic of ACLS was reported as being intimidated and being very difficult to memorize and recall rarely used algorithms. The newly licensed nurses stated they anticipate taking in a large amount of information in just 2 days, but then not knowing how to best retain that information. The Journal of Advanced Nursing supports the efficacy of learners being mentally prepared for learning, as well as the need for repetitive practice to retain knowledge. The Journal of Advanced Nursing also reports self-confidence in nursing promotes improved patient outcomes. Due to necessary COVID-19 precautions, this innovation will include a PowerPoint presentation as well as open discussion in a classroom setting. The PowerPoint will be delivered via email approximately 1 week before class, and during class for simulation and open discussion we will observe social distancing and everyone will be required to wear a mask. By completion of this learning module, learners will be able to identify critical cardiac emergencies, identify methods to prepare for learning, and methods to improve knowledge retention. The innovation is based on Patricia Benner's novice to expert nursing theory. This theory proposes that expert nurses develop skills over time through a multitude of experiences and education. Dr. Benner's theory does not focus on how to be a nurse, but how nurses acquire knowledge. This theory promotes that continual practice to develop skill is an ongoing process throughout your career. Learners will complete a pre-assessment of their learning goals, which will be returned via email to this educator privately prior to class. Post-evaluation will include a 10-question test on information presented in the PowerPoint and classroom teaching, and a 5-point Likert type scale. The format for the Likert item will seek to determine agree or disagree and will be used for benchmarking. There will be approximately an hour allotted post-certification and post-classroom training for open discussion. I plan to discuss with learners if they felt their goals were met, and I will also seek input from them on how this innovation could have benefited them more. I thank you all for your time, and I welcome any input that you may have.